Yes, and I can see that that might be an approach to take in a large organisation like an NHS trust. For most of our audience today, they will be working in relatively small practices, if not working as sole practitioners, where they aren't really having to set an example to any fellow staff members, because there aren't any, or there are very few of them perhaps. I am wondering, how do they go about, how do they identify, recognise the clues that might be apparent in a consultation where their focus is on musculoskeletal injuries, but there might be that huge psychological component that you talked about?
Yeah, I mean, it depends on your own practice, I think. I mean, some people will be more. I mean, I think there's a baseline expectation, which I think would be, as you're, a healthcare professional and primary care, um, I think you should, if someone is making it clear to you that they need help, I think you do need to understand the local options available. And
Yes.
I can't speak to everyone here because I know it's across the UK and further afield, but we've done a lot of work in Northamptonshire recently with Mind there, and it's the landscape of trying to get access to mental health support is very complicated.
Hmm.
And I think what you need, but that being said, it wouldn't take more than an hour or two of sitting down, doing some research online and understanding where the good charities are, where some good options are in terms of wellness practices and stuff like that. So I think it would be about creating your own little signposting list, and I think just to have that and maybe have it as a printout. And if you think someone's struggling, just say, I know some of these things are helpful. I just thought I'd give it to you. That would be, I think, a very good baseline. If you want to get more proactive and be more kind of in tune with it, I think a bit of an understanding of a bit of education around mental health. And I don't want to go. There are lots to talk about, obviously, but maybe giving depression as an example. I'll give you an example of some of the symptoms you might see. So when you think about depression, there are three core symptoms. So there's the obvious one, low mood. But what comes with that is also what we call inertia, so lack of energy.
Yes.
Everything feels really hard. I'm tired all the time. And anhedonia, which I think is the most profound symptom of depression, which basically means the opposite of being hedonistic. So you've lost interest in anything. You don't have that natural desire to go and see your friends or to do anything. So everything becomes an effort. And then you've also got two other triads. You've got a biological triad. So you've got things like change in sleep pattern. You've got reduced libido, but basically, I think the ones like depression and anxiety, if you're interested, those would be the ones to sit down and just kind of get a baseline understanding of the signs and symptoms.